It's Wendy Bowen, physiotherapist with Know Your Body Better. I've mentioned in another video the trochanteric bursitis, which is the pain in the outer part of the hip. But in that video, we talked a little bit about the medius muscle and the piriformis. So I wanted to give you some tips on Piriformis Syndrome, because a lot of people will come to me and they tell me they have sciatic pain, or they've heard the word piriformis. Now, piriformis is a muscle that comes off the back of the hip and comes across into your tailbone, where your tailbone sits in between these two wing bones, comes right across in there. Now, the one thing about the piriformis muscle is the sciatic nerve comes through in front or behind that muscle. And so you get some referred pain often down the back of the leg. So people will often think they have sciatica, which can be coming from the lower back. But typically, if it's going just down to the knee, the pain is through the back of the leg or outer thigh here, it can be coming from that gluteus medius muscle or the piriformis. So what do you do about it? Well, there's a few stretches you can do. Piriformis syndrome is generally pain in the buttock, back of the thigh when you're sitting. That's generally when people feel it. When they get up and move around, they feel better. So one of the stretches that I like to give people is this figure 4 stretch. So foot up on the knee, push down as you lean forward. So I can feel the stretch through my buttock area right now. And usually it hurts while you're stretching and then it feels good. So that can be one stretch. You can also pull the knee up this way, and that'll often give you the stretch through this outer part of the buttock muscle out through here. So I like these two stretches. You can also do those stretches while you're lying down. Across there, you can push out, or you can bring this up a little bit like this and get another stretch. Sometimes I like to put this foot on top of a ball or on a chair if you're a little tight and can't reach through. You can reach through and grab and pull up a little bit more. You can also do this one where you're just pulling the knee to the opposite shoulder, getting that nice stretch down through here. But what about strengthening the piriformis? Because sometimes the muscle needs strengthening. And this exercise that I like is you lie on your side here, your knees together, rotate your foot up this way, and then bring your knees apart just a little bit while you're keeping that foot rotated, and then down and rotate down. So rotate the foot up, knees apart a little bit. You should be feeling it right here in the back of the buttock, and down, down. You should not feel this one in the front of the hip. So again, roll up, lift up, knees together, feet together. Okay, one more time, feet apart, knees together, feet together. And I would suggest doing that 10 to 15 times, 3 sets, or until fatigue. If it starts to hurt, stop, do the other side. And you can compare one side to the other and see how many you can do on the one side versus the other side. And often there's a asymmetry between the two. So you can work on stretching the tight muscles in the hip and strengthening the tight muscles in around the hip, the piriformis. So again, there are things you can do to help us as physiotherapists work with your body. So it's Wendy Bowen with Know Your Body Better.